White House for another meeting tomorrow. But, and then we'll see what happens out of that.
Talk about an example of manufactured urgency. Is it not the case, I asked my friend from Arizona, that the benefits under this bill don't kick in until 2014?
Well, you know, my understanding is that if you go out and buy a car today from any car dealer, that you don't have to make payments for a year. You can get that kind of a deal if you want it. This deal is exactly upside down. You get to make the payments early, and then you get to drive the car after 4 years. So
the urgency, it strikes me, I would say to my friend from Arizona, the urgency is to get this thing out of the Congress before the American people storm the Capitol. I mean, we know from the survey data, do we not, that the American people are overwhelmingly opposed to this bill. And so what is the argument I keep hearing on the other side? I was going to ask my friend from Arizona, I hear that the president says, and others say, let's make history. Well, there's been much history made, but much of it has actually been bad, right?
Well, and I'd also like to say that there's a history that we really should not ignore. And that is that every major reform ever enacted in modern history of this country has been bipartisan. Whether it be Medicare, whether it be Social Security, whether it be welfare reform, as we remember under President Clinton, every major reform has been accomplished by Democrat and Republicans sitting down together and saying, okay, what is it that we have to, what kind of an agreement do we have to make? And some of us around here have been around here long enough to remember in 1983, Ronald Reagan and Tip O'Neill, the liberal Democrat from Massachusetts and the conservative Republican from California, sat down with their aides across the table and key members of Congress, and when Social Security was about to go broke. Why can't we, since there must be areas that we agree on, now say to our Democratic friends and the president, rather than trying to ram 60 votes through the Senate, why can't we now sit down and proceed in a fashion, we'll give things up. We're willing to make concessions to save a system of Medicare that's about to go broke in 6 years. We'll make some concessions, but get us in on the takeoff. And don't expect us to be in on the landing when already the bill is written and the fix is in, just as the fix apparently is in on the Dorgan Amendment. So,
could I say to my friend from Arizona, no one has done more in the Senate in the time that I've been here to express opposition to and warn us about the perils of excessive spending. And as I recall, one of the things you came back after your campaign and told us is what the American people are concerned about is the cost of health care. The cost of health care. And of course, we're also concerned about government spending, the cost to consumers of health care and cost to government spending. Dr. Christina Roma, who's a part of the White House economic team yesterday on one of the shows, said we're going to be expanding coverage to some 30 million Americans. And of course, that's going to up the level of health care spending. You can't do that and not spend more. Now, maybe she didn't get the talking points for yesterday's appearances, but here you've got conflicting messages out of the White House on this very measure. In short, I think it is safe to say this is a confused mess, a 2,100-page monstrosity of confusion and unintended consequences, and yet they are in this rush to enact a bill, the benefits of which don't kick in until 2014, before Christmas Day this year. I'm astonished at the irresponsibility of this.
It's a remarkable process we are going through. I know my friend from Tennessee here, and I know that he, being the head of our policy committee and a major contributor to keeping us all informed and up to date, is here, and I know he'd like to say something, but I'd like to say something that I had not planned on saying, and that is that this has been a vigorous debate. We've been able to, I think, act in a way which has been, in an effective way, which has been reflected in the polls of the American people by, as you mentioned, largely opposed to this measure and greatly supportive of a process where we could all sit down together with the American people in the room, to be honest with you, when we're talking about 1/6 of the gross national product. And the Republican leader's job has been compared by one of his predecessors as herding cats, and I agree with that, or keeping frogs in a wheelbarrow. I'm not sure which is right. But I have to say that I have not seen the members, Republican members on this side of the aisle, as much together and as cohesive and working in the most cooperative and supportive fashion of each other since I've been in the United States Senate. For that, I congratulate the Republican leader.
Thanks, my friend from Arizona.
I wonder if I might.
Tennessee.
Thank you very much. I'd like to congratulate the senator from Arizona for his comments and his own leadership on this issue, and I'd like to add my commendation to the Republican leader. My thought is the reason we're working so well together is because we're afraid our country's about to make an historic mistake. I mean, there's a lot of talk about making history. There are a lot of ways to make history. I mean, put aside all the laws about race. Let's don't talk about them, because when we talk about race, that's often misunderstood. But we didn't fail to make an historic mistake on laws about race until the 1960s, when we began to correct those laws. And let's put aside all the historic mistakes we might have made in failing to stop aggression before World War II. We know about those mistakes. We can remember historic mistakes. I would ask the Republican leader, the Smoot-Hawley tariff sounded like a good idea when President Hoover pushed it in the late 1920s. We were going to raise tariffs on 20,000 imported goods, create more American jobs, and it created a Great Depression. The Alien and Sedition Act sounded like a great idea. That made little history. Shortly after our country was founded, we were going to made it a crime to publish false and scandalous comments about the government. It's never been repealed. Everyone would agree. Our Supreme Court has said it's an historic mistake. There was something called the Medicare Catastrophic Coverage Act of 1988. I wonder if both the senator from Kentucky and the senator from Arizona might have been here then. So we're very capable of making historic mistakes. And as the senator from Arizona has said very well, most Americans, if presented with a problem, wouldn't try to turn the whole world upside down to solve the problem. They would say, what's the issue here? And the issue here is reducing costs. We all can talk to family members, others. We know what they're paying monthly for premiums. We would like those premiums to be less. And we'd like for the government's costs to be less. So why don't we, as we've proposed day after day, and as the senator from Arizona just said, why don't we go step by step in the direction of reducing costs? And I won't go into the long litany of proposals that we've made. Take 5 or 6 steps in that direction. Small business health plans, reducing junk lawsuits, buying insurance across state lines. We should be able to agree on that. Instead of a 2,000-page bill that raises premiums, raises taxes, seems to have a problem a day. So I think the cohesion on the Republican side is not so partisan. I mean, most of us, I know I like to work across party lines to get results. That's why I'm here. I'm just afraid that our country is about to make an historic mistake, and we're trying to help let the American people know what this bill costs, what it does to them and their health care.
The fear is palpable. In addition to the public opinion polls we've all seen, we're each having experiences with individuals. I just cite 3 within the last couple of days. I ran into a police officer, a long-term police officer, African-American police officer, came up to me and he said, Senator, you gotta stop this health care bill. And then healthcare providers. I see Dr. Barrasso from Wyoming here. I, within the last week, spoke to one of the nation's fine cardiovascular surgeons. He said, please stop the health care bill. This is going to destroy the quality of our profession. He told me of a friend of his, a neurosurgeon, who had called him with the same concern. I get the sense that there are an enormous number of healthcare providers, physicians, hospitals, everybody involved in the healthcare provider business, apparently with the exception, as Senator McCain points out, of the pharmaceutical industry, which seems to have cut some special deal here, who are just apoplectic about the possibility that the finest healthcare in the world is going to be destroyed by this, as the senator from Tennessee points out, historic mistake.
Could I